the anatomy, and you have to excuse my writing because we have doctors writing, anatomy of the upper eyelid. This will be pretty basic and it's just to give you a general understanding. Now the eye, what we're talking about now is a cross section through the eyelid. There's other quite complex anatomical discussions to be had about the retaining ligaments around the eyelid which give it support, as well as the fat pads around the eye and eyelid, which is something we talk about when we're assessing patients for cosmetic surgery. So if we take, let's pretend this is your brow, so this is bone, okay, and this is the cheekbone, which we call the zygoma. I'll call that bone as well. In there you have globe, which is your eye. All right, globe, and that's made of different parts, pupil, iris, etc. But what we're specifically looking at is areas in the upper lid. So the first thing we have here is skin, okay, skin. And under the skin is a layer of muscle, and it's divided into different parts, but the bit in front of the eyelid is called the orbicularis oculi muscle, and there's prepalpebral and pre-septal and pretarsal parts. So the pretarsal part sits above a plate, a cartilaginous plate, which is called the tarsal plate, and that's one of the things that give strength to the upper eyelid. It's supported on both sides by ligaments, and that's the thing that you flip over when you have your eyelid inverted. All right, now coming down from here is something we call the orbital septum. The orbital septum divides the eye into anterior or preseptal and postseptal compartments, okay? Between the orbital septum and the orbicularis oculi can be a bit of fat, and we call that as in before septal fat, okay? And out of here come eyelashes, all right? And around here comes a muscle that we call the levator palpebrae superioris, and this continues as a sheet we call the levator aponeurosis, and this slings around a structure called Whitnall's ligament. All right, Whitnall's ligament is an important ligament or retaining ligament of the eye. Now behind the septum, again, you can guessed it correctly, is postseptal fat. All right, and running from the bottom of the levator to the top of the tarsus is a little tiny muscle. This is called Muller's muscle, and this muscle is actually innervated by the sympathetic or autonomic nervous system. So it's not something you have voluntary control over, all right? So if this muscle is damaged, you have 2 to 3 mils usually of ptosis or drop in the upper lid as a result of damage to this muscle. Deep to this is another layer, and that's the conjunctiva. The conjunctiva is basically the pink lining on the inside of the eyelid. And all of this is obviously lubricated, so there's large lacrimal glands in the upper lateral quadrant of the eye contributing to tears. There's also glands coming through the tarsal plate, the Mobian glands, as well as glands going on to this aspect of the plate and to the lashes called glands of Zeiss and glands of Mole. The tear film's actually trilaminar, so a tear film has a kind of a mucin or mucus layer which is slippery on your eye, and that's mucus, okay, or mucinous. An aqueous layer, which is the thick layer, which is basically water, all right, and then the top layer, the lipid layer, which is oily, and that stops your tears from evaporating off the surface of your eye. So interestingly, in an Asian versus a Caucasian eyelid, there's some differences. So this levator, as it comes through here, it actually gives little penetrating fibers through the muscle and onto the skin, and that forms this crease. This doesn't happen in the Asian eyelid, and that's why you don't have the upper eyelid crease that you see in Caucasians. And also this preseptal fat seems to, or it does, descend further down. So that's why you have that fuller upper eyelid without the septum. So that's a very basic, quick run through to most of the components in the upper lid. The lower lid is similar, they're named different things. So instead of a levator, we have a capsulopalpebral fascia, which helps retract the lower lid, and that slings around the inferior oblique muscle, which is an extraocular muscle of the globe. But in general terms, that's just some of the main anatomy to do with the upper lid in a very basic way.